Well, a warm welcome to this should be fairly brief video today. Now, I want to carry on with the coverage from the Westminster Hall debate, which is like a sort of mini parliamentary debate, really. It's not in the main chamber of the House of Commons, as this debate on excess deaths, of course, should have been. So it's kind of a mini debate, but it was, it's fairly poorly attended, well attended by the public, of course. That public gallery was full. It's pretty small, but some pretty high quality input from some members of Parliament. Now, I want to highlight Mr. Philip Davies, Member of Parliament for Shipley, his contribution. And just listen to some of the key points. People dying unexpectedly, all ages dying more than would be expected, all age groups, mostly people dying at home. So what proportion of these are dying suddenly and unexpectedly? Of course, we don't have that data, but that would be interesting. Trends, he points out, young and middle-aged adults mostly dying from cardiac causes, as we looked at just recently. Since 2021, 90% of these deaths have not been COVID-related. This is not a direct COVID effect. And he says the COVID inquiry, which is costing hundreds of millions of pounds with lots of really expensive lawyers, he calls that, now I think this is a technical term, but he uses the term tittle, tattle. I hope that translates in the States. Tittle tattle, just tittle tattle. Lockdowns, health service delays, COVID-19 vaccination adverse reactions, multiple potential causes for this excess mortality. I wanted to cover this because it's really not being covered on the mainstream media, and some channels, of course, are even attempting to misinterpret what honourable members of Parliament are saying. So if you listen to it directly from the bloke himself, there's nothing to argue with. Thank you, Mr. Davies.
3 minutes, colleagues. 3 minutes.
As we've seen in data published by the ONS, non-COVID excess deaths continue to run higher than they should. People are dying unexpectedly across all age groups, particularly, it seems, at home. Since restrictions in March 2020, there have been 111,000 excess deaths in people's own homes. And in the week ending 22nd of December 2023, deaths at home were 11% higher than the 5-year average. In the first 11 months of 2023, over 21,000 excess deaths took place at home, roughly one every 25 minutes. Just last month, an article in the Lancet, co-authored by the head of mortality analysis at the ONS, stated that while the causes of these excess deaths are likely to be multiple, ONS data did show some clear trends. In particular, the largest relative excess of death since the pandemic occurred in young and middle-aged adults, with cardiac deaths happening outside of hospitals the most elevated. In other words, young and previously healthy people are dying at home from cardiac-related events, and we don't know why. They go on to conclude that timely and granular analyses are needed to inform prevention and disease management efforts. But let's be clear, this is not a new phenomenon. Experts have been raising concerns on excess death as early as 2021. I remember seeing an interview with Professor Carl Hennigan, the Professor of Evidence-Based Medicine at Oxford University, where he called for an investigation into the 75,000 excess deaths at home between the period of March 2020 and October 2021. 90% of these excess deaths were not COVID-related, but were things like diabetes, heart disease, and also cancer. Many of these deaths could have been prevented had people not been dissuaded from seeking care because all they were told everywhere by the media, by the government, was stay at home, protect the NHS. Or maybe they had tried to get help, but were dismissed by a health service only concerned with one disease. Those calls for an investigation went ignored then, just as they are ignored now. Perhaps the COVID inquiry, as others have said, should make better use of Professor Hennigan's time by asking him about this topic rather than the tittle-tattle they seem to revel in. The pertinent question is, why did we lock down at all? And this is really what I think is the biggest damage. Time's of the essence, Sir Gary, so I want to finish just by saying, look, we can all speculate on the cause of this excess deaths, which are clearly happening. From withdrawal of healthcare during lockdown, the increased risk of sedentary lifestyle and alcohol consumption, the impact of the pandemic and related restrictions on NHS staffing levels, increase in NHS waiting times, lack of access to emergency care, the COVID-19 vaccine adverse reactions, or some other unknown cause. A mix of all of the above, perhaps. But until the government commits to a robust and independent investigation, we just won't know for sure and the speculation will keep going, and that's why the government need this investigation rapidly.
Thank you.
Young people dying for cardiac reasons at home, this should not be happening. 110, or what was it, 111,000 excess deaths since the start of March 2020. These are just huge numbers of people have died excessively, more than we would expect, and many of these, the majority of these, not attributable to COVID. September the 11th, 2021, there was 2,996 deaths, including 19 terrorists. Here we're talking well over 100,000 excess deaths, and no one officially seems to be taking this seriously. So all we're calling for here is a robust, independent investigation. What's wrong with that, with Philip Davies? What's wrong with that? And personally, I think it would be a good idea if he agreed. Professor Carl Hennigan, Centre for Evidence-Based Medicine at Oxford University, could be put in charge of this, because we are not short of clever people to do this investigation. He could sort this out, appoint academics around the country, appoint doctors, appoint statisticians. He could do all this, and I suspect he could do it for one heck of a lot of money than this tittle-tattle official inquiry that's going on. So we wait for a reply from the government. Don't hold your breath, unfortunately. I really suspect, and I've got a reason for saying this, but I can't really share too much, but I really suspect we're not going to see movement on this side of a general election, which is probably going to be coming later in this year in the United Kingdom. After that, I think more information will start to come out, but until then, maybe it won't, but we'll keep trying. And for now, thank you for watching.